Welcome back to MedSense. You know me, I love breaking down complex medical topics into easy-to-understand pieces. Today, we're tackling a process that's fundamental to how our body defends itself, acute inflammation. Now, before you start thinking, inflammation, that sounds bad. Remember, inflammation itself isn't inherently a bad thing. It's your body's natural way of responding to injury or infection, kind of like its own built-in defense force. Think of it as your body sounding the alarm, calling for reinforcements to deal with a problem. Over the next few minutes, we're going to dive deep into what causes acute inflammation, the key events that unfold within your body, and the potential outcomes, both good and bad. So buckle up, get ready to learn something new, and let's get started. So, what exactly triggers this alarm system in your body? Well, acute inflammation can be set off by a whole bunch of things. Think of it like this. Anything that disrupts the normal balance in your body can potentially be the culprit. One of the most common causes is infection, those pesky bacteria, viruses, and fungi that try to invade our bodies. When they do, our immune system jumps into action, triggering inflammation to fight them off. But it's not just infections that can set things off. Physical injuries like cuts, burns, or even frostbite can also cause inflammation. Then there are things like foreign bodies. Imagine getting a splinter or inhaling dust. Your body sees these as invaders and launches an inflammatory response. And it's not just physical things. Certain chemicals can also be irritants. Think about having an allergic reaction to pollen or coming into contact with a harsh chemical. Inflammation is often part of the body's response. And finally, there's tissue necrosis, which is basically when cells in your body die due to things like lack of blood flow. Your body triggers an inflammatory response to clean up those dead cells and start the repair process. Now let's talk about what happens inside your body when acute inflammation kicks in, specifically in your blood vessels. Remember those reinforcements I mentioned earlier? Well, your blood vessels play a key role in getting those reinforcements to the site of injury or infection. Think of it like this. You have a fire in your house and the fire trucks need to get there fast, right? So the first thing that happens is a brief initial constriction of the blood vessels around the injured area. It's like a temporary roadblock to assess the situation. But then almost immediately those blood vessels widen. That's called vasodilation. And it's like opening up all the lanes on the highway to let those fire trucks through. This widening allows more blood to flow to the injured area, bringing with it all those important immune cells and other helpful substances. Now, as more blood flows in, you might notice some swelling in the area. That's a classic sign of inflammation. And finally, there's something called stasis, where the blood flow in those tiny vessels, the capillaries, actually slows down. This allows those immune cells to get up close and personal with the problem area. Okay, we've talked about the changes in the blood vessels themselves, but let's zoom in even closer and talk about what's happening with the blood flow. Normally, blood flows smoothly through your vessels, kind of like a calm river. But during inflammation, things get a little more turbulent. Instead of that smooth, streamlined flow called laminar flow, inflammation causes the blood flow to become more chaotic, like rapids in a river. This change in flow is important because it helps those immune cells get closer to the walls of the blood vessels. And as the blood flow slows down, something really interesting happens. Those white blood cells, the first responders of your immune system, start to move towards the edges of the blood vessels, kind of like they're lining up along the sides. This process is called margination, and it's a crucial step because it allows those white blood cells to exit the blood vessel and get to the site of the problem. Now, let's talk about the real stars of the show, the cells that are going to tackle that infection or injury head on. We already talked about how white blood cells line up along the blood vessel walls, but how do they actually get to where they need to be? Well, remember that the blood vessels have become more permeable, kind of like the walls have become a little leaky. This allows those white blood cells to squeeze through those tiny gaps and enter the surrounding tissue. This process is called transmigration or diapedesis. And it's like those immune cells are breaking through the barricades to reach the battlefield. But it's not just a random free-for-all. Those white blood cells are guided by chemical signals released by injured cells or even the invading pathogens themselves. It's like they're following a trail of breadcrumbs, leading them directly to the source of the problem. This process is called chemotaxis, and it ensures that those immune cells are laser-focused on the task at hand. Now, different types of white blood cells play different roles in the inflammatory response. One of the first responders is the neutrophil. These guys are like the frontline soldiers, rushing in to engulf and destroy bacteria and other pathogens. Now, I'm sure many of you have experienced inflammation firsthand, even if you didn't know what was happening at a cellular level. But how do you know if you're experiencing inflammation? Well, there are 5 classic signs, often called the cardinal signs of inflammation. First up, redness. Remember all that blood rushing to the area? That increased blood flow is what gives inflamed tissue its characteristic red appearance. And where there's redness, there's often heat. That warmth is also due to the increased blood flow, bringing your core body temperature to the site of inflammation. Then there's swelling, which we've already touched upon. It's caused by the leakage of fluid and cells from those blood vessels into the surrounding tissue. And of course, there's pain. Inflammation can be a real pain, literally. The pain is caused by a combination of factors, including the release of chemical mediators that irritate nerves and the pressure from all that swelling. And finally, there's loss of function. When a part of your body is inflamed, it's often harder to move or use it normally. This is the body's way of protecting the injured area and allowing it to heal properly. Let's dive a little deeper into the world of these amazing immune cells, starting with the neutrophils. Think of neutrophils as the first responders, the brave soldiers rushing into battle when the alarm bells of inflammation start ringing. They're the most abundant type of white blood cell in your bloodstream, making up about 50 to 70% of your circulating white blood cells. Neutrophils are quick to the scene, usually arriving within the first 6 to 24 hours after the initial trigger. They're drawn to the site of injury or infection by those chemical signals we talked about earlier. Remember chemotaxis? Once they arrive, they get straight to work engulfing and destroying bacteria, cellular debris, and other foreign invaders through a process called phagocytosis. They're like tiny Pac-Mans, gobbling up anything that shouldn't be there. But here's the thing about neutrophils. They're kind of like the kamikaze pilots of the immune system. They have a very short lifespan, usually only surviving for about 1 to 2 days. So they expend all their energy fighting off the invaders and then they die off, often contributing to the formation of pus at the site of infection. While neutrophils are the first responders, they're not the only players in this intricate immune system game. Other white blood cells, or leukocytes, play important supporting roles in the inflammatory response, each with their own unique set of skills. Eosinophils, for example, are like the specialists called in for specific missions. They're particularly important in fighting off parasitic infections, releasing toxic substances that can destroy those larger invaders. You'll also find eosinophils in higher numbers during allergic reactions, where they contribute to those uncomfortable symptoms we all know too well. Then there are basophils, which are like the signal flares of the immune system. They release histamine, a chemical that causes blood vessels to dilate and become more permeable. This increased blood flow and permeability help bring even more immune cells to the area, amplifying the inflammatory response. Basophils also play a role in allergic reactions, contributing to those itchy hives and other allergic symptoms. And let's not forget about macrophages, the cleanup crew of the immune system. They're larger than neutrophils and arrive a bit later, usually within 24 to 48 hours after the initial trigger. Macrophages are like the garbage trucks, engulfing and clearing out dead cells, debris, and any lingering pathogens. They also play a crucial role in initiating the tissue repair process. We've talked about phagocytosis, but let's take a closer look at this amazing process that's essential for clearing out invaders and cellular debris. Imagine a neutrophil or macrophage encountering a bacterium. The first step is recognition. The immune cell needs to identify the bacterium as a threat. They do this by recognizing specific molecules on the surface of the bacterium. kind of like identifying a suspicious character by their outfit. Once the threat is identified, the engulfment process begins. The immune cell extends arm-like projections called pseudopodia, which surround and engulf the bacterium, drawing it into a membrane-bound vesicle called a phagosome. It's like the immune cell is wrapping the bacterium in a tight hug, but this is one hug the bacterium won't enjoy. Now, trapped inside the phagosome, the bacterium faces its demise. The phagosome fuses with another vesicle inside the immune cell called a lysosome, forming a phagolysosome. Lysosomes are like the recycling centers of the cell, filled with powerful enzymes and toxic substances. These enzymes and toxic substances are released into the phagolysosome, breaking down the bacterium and destroying it. It's like the bacterium has been thrown into a vat of acid, completely neutralized. This process is crucial for preventing the spread of infection and clearing out any unwanted guests from your body. Now, you might be thinking, this inflammation sounds pretty intense. How does it ever stop? Well, the good news is that acute inflammation is designed to be self-limiting. Your body has built-in mechanisms to resolve the inflammation once the initial threat is dealt with. Think of it like this. You wouldn't want the fire alarm blaring forever after the fire is out, right? Similarly, you don't want inflammation raging on unnecessarily. One way your body regulates inflammation is by producing anti-inflammatory mediators. These are like the peacekeepers, calming things down once the battle is won. These mediators help to counteract the effects of the pro-inflammatory mediators that were released initially, bringing the inflammatory response to a gradual halt. As the threat subsides and the inflammatory response winds down, those neutrophils that rushed in early on start to die off. Macrophages, the cleanup crew, clear away the cellular debris, including those dead neutrophils, and begin the process of tissue repair. The blood vessels gradually return to their normal size, reducing redness and swelling. Pain subsides, and function gradually returns as the tissues heal. It's like the body is putting itself back together piece by piece after the storm has passed. In most cases, acute inflammation resolves successfully, leading to complete healing without any lasting damage. It's like your body has successfully defended itself and emerged victorious from battle. This resolution is the ideal outcome, restoring your body to its normal state. However, in some cases, acute inflammation can progress to chronic inflammation. This can happen if the initial trigger isn't completely eradicated or if there's an underlying autoimmune condition. Chronic inflammation is like a smoldering fire, causing ongoing damage to tissues and potentially leading to long-term health problems. In other cases, healing may occur by fibrosis, where scar tissue forms as part of the repair process. While scar tissue helps to close wounds and strengthen damaged areas, it doesn't function in the same way as the original tissue. Excessive fibrosis can lead to organ dysfunction and other complications. And finally, in some instances, an abscess may form. An abscess is a collection of pus within a tissue, often surrounded by a wall of inflamed tissue. Abscesses can be painful and often require drainage or surgical intervention to resolve. Understanding the potential outcomes of acute inflammation highlights the importance of seeking prompt medical attention for any signs of infection or persistent inflammation. So there you have it, a deep dive into the fascinating world of acute inflammation. We've covered a lot of ground, but I hope you gained a better understanding of how your body responds to injury and infection. Remember, acute inflammation is a natural and essential part of your body's defense system, but it's important to be aware of the potential complications and seek medical attention when necessary. If you're experiencing any signs of inflammation that are severe, persistent or concerning, don't hesitate to reach out to your healthcare provider. They can help determine the underlying cause and recommend the best course of treatment. And as always, thanks for watching. Don't forget to subscribe to MedSense, where we make medicine make sense, and hit that notification bell so you don't miss out on future videos. Stay informed, stay healthy,